All right, here's the big one though, supporting counselors' well-being. So let's not forget to nourish ourselves. Counselors need to focus on our own personal well-being. Counselor burnout is real. Counselors have the highest rates of burnout of all the helping professions. Studies estimate that 50% of counselors experience moderate to high levels of burnout. That's really high. So we need to pay attention to symptoms of burnout. And those symptoms can include things like emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment. Some of the risk factors of burnout include high caseloads, lack of work-life balance, emotional demands of client care, and insufficient support. This burnout can cause reduced empathy and effectiveness in sessions, increased risk of errors or ethical breaches, and it can take a personal toll, such as high levels of stress, anxiety, and depression. So, some proactive strategies I want you personally to take away and think about today to prevent burnout include self care, right at the top, self care practices. Things like setting boundaries between work and personal life, engaging in hobbies, exercise, getting adequate rest. Look at personal development, participate in supervision or peer support groups, and learning new therapeutic techniques to keep your sessions engaging, rewarding, and fresh. And workplace advocacy, encouraging manageable weight caseloads and fair compensation, as well as building a culture of support and open communication within your organizations. Additionally, use some of the evidence-based interventions that we touched on for your clients today. Turns out they work just as well on ourselves. So thinking about some of those are your mindfulness-based interventions, your cognitive behavioral strategies, those wellness programs like yoga and stress management, building resiliency and emotional regulation because you're often in high pressure situations, recognizing and addressing secondary trauma stress. That's really important as we are exposed to our clients' trauma. Spending time every day, you should do that every day. If you can't do it, try to build in at the end of every session